Hey guys, Sean here with TDSJ, and welcome back to Let's Play Live Virtual Surgery MultiSurgery Hospital. So on the last one we did a C-section. Today we're going to do the brain surgery, and then we'll kind of skip around and seeing how long it takes us to do the brain surgery. We might do two, we might do one, it all depends, like I said in the last one. So here we go. Brain surgery.
Call 911. Clean the blood with the cotton.
Clean the blood with the yeah, yeah. We done? Is there more blood somewhere?
Ow! Ambulance has arrived. The patient is in serious condition. We need to rush to the nearest hospital to save his life. We have reached to a hospital. Let's take him to emergency ward.
Went right through the nurse.
Hi, I am Dr. John. Today we have a patient, and he has severe injury on his head. I will assist you in the entire procedure. Let's begin with the surgery immediately. First of all, take the syringe and inject the intravenous anesthetic. Take the shaving cream.
Told me to inject him.
Take the razor from the toolbar. Ouch! Shave the head properly.
There was nothing on there to give him the anesthetic with. There was no needle and syringe.
Ouch!
Yeah, shut up. I used to shave my head all the time. There you go. Shave that.
Ouch!
There you go. Let's get this. Is that good?
Ouch!
Oh, shut up.
Take a marker.
Does it
Draw the dotted lines.
have to be black?
Ouch!
It's a felt tip marker. Shut that.
Ouch!
You big baby.
Ouch! Take the scalpel. Now make an incision through the skin of the patient's head. Ouch!
Oh, fingers in the camera again. Sorry about that, guys.
With the help of the scalpel, cut the muscle to gain access to the skull.
No.
Ouch!
You should be out by now.
Take the drill. Now drill 4 holes into skull.
Shouldn't you have that drill bit? How far we're going in? Because I'm pretty sure that. Looks like we're going in.
Take the surgical saw. Now cut the skull so that we can get access of brain. Ouch! Take the scalpel.
Why
Now make an incision through the dura mater.
And I'm pretty sure we're going to be cutting into the bone.
In order to open the brain, gently open a corridor with the help of retractors for access to the aneurysm. Use the microscope to look inside the skull.
The microscope, this thing?
Take the dissector tool. Now remove the retractors from the patient's head. Take the needle.
But we left a tool in there. We're going to get sued for that. We left... I mean, then again, that could stay in there. I have no idea. Like I said before, maybe that just stays in there, but...
Ouch!
Most of the time, I know that the...
Take the drill and make 4 holes through the bone. Ouch!
I know they come out pre and post.
Place 4 of them into the skull.
But I don't know why they would just leave it there. That doesn't make sense. There's obviously a glitch.
Take the screwdriver.
There's obviously a glitch with that corner piece of the skull that stayed on there, but yeah, that's a good game mechanic right there. Oh, I gotta individually put it on each screw with my fat finger in those.
Pick the needle to suture the muscle.
Pretty sure you still got a piece of your skull.
Now suture the skin of patient's head.
Pretty sure you still got a piece of skull sticking on the outside of your head, but whatever. I don't make the game.
Ouch! Ouch! Tie the bandage carefully on the patient's head. Congratulations! You made a successful brain surgery.
Except for that piece of skull sticking outside of his head.
Call 911.
Let's see if we can back out of that. I didn't mean to. There we go. So we did the brain surgery one. It was actually pretty quick. I mean, we're only 8 minutes in. So I'm going to do 2 on this one. So we'll do the... That's what I'll do. I'll just do 2 and 2. So the C-section was first. I'll do the brain surgery and the knee surgery on this one. And then in the next video, we'll do the stomach surgery and the toenail surgery.
Call 911. Hello, I am Dr. John. I'm here to guide you throughout the procedure of knee surgery. Let's check the vital signs before the surgery. Without checking this out, we cannot proceed.
Sounds good.
Apply the betadine solution on the entire surgical field so that the patient's leg is bacteria-free. This will reduce the chances of any type bacterial infection.
We missed a spot.
Draw the outline with the help of marker on the patient's knee.
Oh, you can't draw. There we go. There. Make sure we get it all. Yeah, glad it fixed it for me.
With the help of marker, draw the incision line.
Here we go. This ought to be fun. Yeah, just cut everywhere. Yep, just take this piece out. Yeah, there we go. Yeah.
Take the scalpel to make a cut on the marked area.
That helps me guide it.
Use the bovie to cauterize the bleeding veins to reduce the blood flow in the surgical field.
Oh, forgot one.
For the surgery, patient's knee should be elevated so that patient's knee is fully exposed.
So I've noticed on this one that they actually use some of the correct terminology, because when I worked in central processing, we would restock and build case carts for the surgery, and we would put those bovie tips and other instruments that the surgeons would use in surgery. So this game seems to be pretty accurate so far. Did he say a 90 degree?
Patient's leg is in proper angle.
119.
Take the wronger and then tap on the meniscus and each of the 4 bone spurs to reshape the bone. Now reshape other bones, like femur, tibia, and patella, so that new components can be fixed properly. Put the jig into its position, and also the alignment device. Use the mallet and insert the jig pins, so that the jig is firmly placed. Remove the alignment device. Use the bone saw to cut the bone. Take another cutting jig. Along with the bone saw, allows us to finish shaping femur. Now shape the tibia. With the help of the mallet, insert more pins into tibia jig. This will make sure that the leg is properly aligned even after the... Now use the bone saw to shape the highest point of tibia. Use the bone saw to cut the patella. Take the plastic spacer and insert into metal tray component. Now take the metal tray component to attach it to tibia. First, attach the femoral component on the femur bone. And now take patellar component and attach it on the patella. Take the cement and spread it on the surface of femur bone. Tibia. Check the range of motion of the patient's leg. Test the new knee's flexibility by slowly dragging it from 0 to 130 degrees. Wait for 10 to 15 minutes so the cement can dry properly. time to stitch up the fat layers.
So that's pretty neat that it gets into that much detail.
Use the stapler or suture to close up the incision.
It's like a desk stapler.
This can't be your first knee surgery, is this?
So yeah, so there we got it. So there's two. And we're 15 minutes in, so that's a pretty good gameplay. Let's play on this one. So next video we'll do the stomach surgery and the toenail surgery. Get that in. That's kind of a cool animation I didn't know about. If you click on the girl, she actually does the defibrillator paddles, which is kind of neat. So yeah, so that was the brain surgery and the knee surgery, and like I was saying, this one actually kind of goes into some better detail on, you know, the bones, the anatomy, and the tools that are used with some of the procedures that would go on in a hospital or in a surgery setting. So that's actually pretty neat. So yeah, we'll see you guys in the next video. I hope you enjoyed this one. See you guys later.